Weeks turned to months without any sign the end of the COVID-19 pandemic was near. Now the promise of a vaccine seems like the world's best bet to get back to life as we knew it.
We want to achieve what we call herd immunity, and that's when there are enough people in the population who are either immune because of that natural infection or because they received the vaccine such that the virus can't actually spread any further. And so if we have enough people in our community who are vaccinated, we're inevitably protecting those who are unvaccinated or unable to be vaccinated.
In order to achieve herd immunity for COVID, most experts believe between 60 to 80% of the population will need to be vaccinated or infected. But with such high demand for a vaccine, some groups will receive priority in the first few months.
So it's definitely going to be hospital-based and emergency room-based. Emergency medical technicians, those folks will be getting the vaccine first.
Austin Public Health will be in charge of distribution in the Austin area. The Department of State Health Services says after medical professionals, vaccines will be offered to frontline workers like first responders.
And then after that, you have to look at the chronically ill, nursing home patients, those over 65 and so on. So it's going to be a real effort.
Doctors say the healthy young population will likely be offered the vaccine closer to the spring or summer months. At least so far, no Texans will be mandated to receive it.
We believe that 75-80% of healthcare workers will take the vaccine. So far, there have been no bad outcomes to speak of, and there's always that danger that there's a late developing problem. We have a reasonable expectation that it's going to be a safe vaccine.
However, there are still groups who have yet to be tested during vaccine trials, like pregnant women and children under 12 years old. Epidemiologists are urging scientists to conduct studies with those populations. Still, the fear that some community or social groups could all out refuse the vaccine is a major hurdle for the medical community.
And so you might have whole populations being out together with really low levels of vaccination. So it's possible that we could see outbreaks, even if we do reach certain levels of herd immunity across the city.